While Canadians grow increasingly skeptical of the global health authority known as the World Health Organization, the Liberal government remains unwavering in its commitment to strengthening the regime's mandate.
The theme of this year's World Health Summit is taking global health to a new level. It sounds great, but what does it mean? Let me suggest three things. First, taking global health to a new level means we need a new global agreement or global accord based on a shared vision.
I'm Tamara Ugolini here with Rebel News to bring you an update on what the World Health Organization is up to as it works to strengthen its global health mandate and authority. We became all too familiar with the influence of the World Health Organization throughout the COVID-19 pandemic pandemonium, and even though their advice and guidance devastated nations, resulted in global economic collapse, caused catastrophic harms to societal fabrics, primarily in developed nations, they are still seeking to broaden and deepen their mandate with next to zero reflection or accountability on how their policy impositions harmed people, apart from, of course, that pharma-centric model that apparently left third world countries behind in novel COVID-19 vaccine procurement that I'm sure they probably in hindsight didn't even want. Now, the WHO has been under fire for essentially attempting a health coup d'etat by railroading its member states in two different ways. The first, through amendments to legally binding international health regulations, otherwise known as the IHR. I've discussed this in length at exposethewho.com, but the second way is also through a new pandemic treaty or pandemic accord, which they've renamed a few different times over the last few years. These two avenues are being criticized for being global power grabs that undermine the health decision-making and the sovereignty of independent nations like Canada. And it's no surprise that the illiberal Justin Trudeau Liberals seem to be huge fans of this development. Listen to Liberal backbencher Minister Marcus Pawlowski say how exciting he thinks the pandemic treaty is.
Was WHO's new treaty on pandemic preparedness, which is being negotiated, and the first draft is out. I found the first draft very exciting with a number of provisions which I thought were very progressive. One of those being a requirement that countries contribute annually to the fund to assist poor countries meet their obligations under the treaty. A second thing would be a benefit sharing provision whereby any products that were made from the genetic sequencing of any new virus would be shared between countries. Any products, 10% of those products would go free of charge to WHO with an option for a further 10% to be sold at affordable prices to WHO. This is, I know, only the first draft. I know this is just kind of coming back to us. But would our country be supportive of trying to get such provisions, which I think many of us at this table feel are in our national best interest, because we know that much of the threat in terms of pandemics will come from poor countries who don't have the facilities to early on detect and respond to diseases. These provisions would help poor countries do that. I think it's in our best interest. Is Canada willing to try to support that in the further negotiations with a view to perhaps having such provisions in the final version of the treaty? And again, I know Dr. Tam, I think, has an interest in international health too, and we have at least one other pediatrician. So maybe we could start with you, Minister, and then we could ask if there's time some of the others.
Thank you very much for the question.
Dr. Pawlowski hasn't left you much time. Take 30 seconds, and we're not going to be able to run that around the table unless it's on a future round.
Just very quickly, I can say that I met today with the U.S. ambassador, and we were talking about how we can work together to strengthen our two countries can work to support internationally preparedness, and it's so important that we work with our international partners to make sure that that we're as prepared as we can be, not only in Canada, and I mentioned just today in question period going out to the facility in Laval that's being built with Moderna so we can make domestic capacity, but as you say, to help other countries to make sure that they're also ready, not only to stop the death and the pain that would come from lack of preparedness in those countries, but because we also know that keeps us safe. So the international work that we need to do is critical.
This all started when the World Health Assembly, which is the decision-making body of the WHO, established an intergovernmental negotiating body, an INB, in December of 2020, allegedly to draft and negotiate a convention, agreement, or other international instrument under the constitution of the WHO to strengthen pandemic prevention, preparedness, and response. They say that it will be based on the principles of inclusiveness, transparency, efficiency, member state leadership, and consensus. But as independent researcher James Roguski, who has previously shared concerns about what the WHO is doing with Rebel News, as he put it, sovereign nations cannot let the WHO impose another conference of the parties with unilateral decision-making authority. And at least one Conservative member of Parliament agrees. Dr. Leslyn Lewis, who has brought forward 2 different petitions on this matter. The first, E-4401, called on Parliament to debate Canada's involvement with the WHO and their international pandemic treaty and those international health regulations, the amendments to them, which could serve to expand the WHO's emergency powers and have the potential to impact Canadians' health care sovereignty. That petition was submitted to the House of Commons on September 26th with almost 19,000 signatures.
Today I rise to present a petition that was signed by the constituents of Haldeman, Norfolk, and by Canadians across this country. 18,973, almost 20,000 Canadians in every single province and territory have signed this petition, which addresses the changes to the international health regulations of the World Health Organization, which is the legally binding rules that govern the conduct of nations when it comes to responding to public health events and emergencies such as pandemics. Understanding that since this petition was signed, there have been further changes to the international health regulations this summer, the petitioners are still concerned that the proposed expansion of the World Health Organization's powers and authorities could have far-reaching impacts on the healthcare sovereignty and lives of health and human rights of Canadians. They are calling for an urgent parliamentary debate on the international health regulations amendments and on the World Health Organization pandemic treaty, which is due to be signed in May 2024.
Minister Lewis has since launched a second petition, E-4623, calling on the Foreign Affairs Ministry to expeditiously withdraw from the United Nations and its subsidiary organizations, including the WHO. Lewis states that involvement with these entities brings more harm than good, while programs like Agenda 2030 and Sustainable Development Goals, SDGs, negatively impact various aspects of life, from cultural values to personal freedom. The petition will close for signatures on February 7th, 2024, but it has already amassed over 46,500 signatures, more than doubling that of the first one. Lewis continues to voice the concerns of Canadians and has garnered significant public support for these petitions, while the out-of-touch Liberals like Minister Pawlowski support their continued development. Should we trade national sovereignty for the illusion of global health security, equity, and pandemic preparedness through essentially biosurveillance? Let me know in the comments below. For Rebel News, I'm Tamara Ugolini. If you're concerned about the WHO's power and decision-making authority in the context of public health and regulations, and how this could affect national sovereignty, then you can check out our reports on this subject at exposethewho.com. At that website, you can also sign our petition if you agree that health decisions should be decentralized, that they should be kept local and never mandated by globalist organizations or a centralized health authority. All of that and more, and to support our work, visit exposethewho.com. Thank you.